All right. Good morning, Dr. Lafferty. I really appreciate you taking time to come and join us on Dr. Osborne's Zone. If you would, let the audience know a little bit about your background, your training, your expertise.
Okay, well, first of all, currently I'm an endowed professor at Nova Southeastern University, and I taught 7 years in the medical school. I still teach medical students and doctors and residents. I put courses together in functional nutrition for our master's program, and now I'm in the pharmacy school putting nutrition programs there. And also, I have a clinic where we do de-prescribing, and that's something new even in the pharmacy world, because we realize that a lot of times people are getting sick from being just put on one drug after another, and it's training that the physician doesn't have. They're not trained only how to put people on drugs, not take them off.
So, in essence, de-prescribing, we have an epidemic of polypharmacy in the US for sure. You're helping people get off and restore health without the need for multiple medications. Is that fair assessment to say?
Well, right. And also for me, because I also am a master herbalist and a naturopathic doctor. So I have a doctorate in pharmacy, and I'm also a naturopathic doctor and a diplomate from the Board of Clinical Nutrition. I will replace supplements. And I think that when we say the word supplements, a lot of patients are just kind of thinking about the vitamins they get off of a grocery store shelf. And a lot of the supplements that I use actually used to be prescription drugs. And so those are the supplements, and those usually are supplements that you get from a chiropractor or a pharmacist or a medical doctor. You can't buy those usually on the drugstore shelf. Some of them could be a little bit dangerous in the hands of people not knowing exactly what they're doing with them too.
So you're using, in essence, nutraceuticals to help people kind of transition away from medicine and re-empower themselves back to good health without being enslaved to drugs
Right.
for the rest of their life.
And 99% of what I use are herbal remedies. So those come from plants, animals, bees, or the sea. So and then I do use a few what we call orthomolecular products that are made a little bit more like drugs are made. And vitamins really are made like the ones you buy off the drugstore shelf. They're really made like drugs, or the exact same thing. And that's because of the history of what happened to the natural products and things like that, homeopathy.
Yeah. Well, we were having a conversation here a few weeks ago at the American Clinical Board of Nutrition annual meeting, and I was a little bit jaw-dropped by some of the things that you were saying about how medical education in medical schools is going. And I'd love for you to kind of highlight what you've seen, both as a professor and practitioner of the arts. What are you seeing in the medical schools? How is the education transitioning away from what it used to be?
Yeah. So, first of all, I guess I've been there for over 12 years, so I didn't probably recognize it at first. But one day, one of my best friends who was the head of executive medicine for University of Miami, and she's actually in the book 100 Best Doctors in America. And I brought her to a conference more on holistic and bioidentical hormones and that type of thing. And one of the things that was shocking to her, and I'll tell this story, that he wrote the book, Are Your Hormones Killing You? Dr. Eldred Taylor was our keynote speaker. And he, first of all, he put the bioidentical hormones, the pictures of those up next to your hormones, because they're called bioidentical because they're identical. And saying that this other really big molecule, which is called progestin, or which is in like Prempro or Depo-Provera, is got a big molecule on it, and it's nothing like your progesterone. And a matter of fact, when they did the biggest study ever called the Women's Health Initiative for Women's Health, the drug company partnered with our government, and that had to be stopped early from those prescription hormones because there was more cancer in the people that were taking them. So anyway, he said that his first day as a resident at Grady Hospital, he had a woman with irregular bleeding, and he asked the chief resident, told him, I have a woman with irregular bleeding. And the chief resident said, how old is she? She's 22. Oh, give her birth control pill. Okay. Then he had a similar case, and she was 42 come in and said that she was 42. And he said, oh, does she have a uterus? Yeah, she has her uterus still. Okay, give her Prempro. And then another woman at 52 comes in and she has no uterus. Oh, give her just Premarin. And he said, well, why did I give one Premarin and the other one's got progestin, which is the fake progesterone. But anyway, he said, oh, if you don't have a uterus, you don't need progesterone. Well, first of all, progesterone's the master hormone that makes all the rest of the hormones. So you do need progesterone. It's one of the reasons, by the way, that people get cramps, women get cramps during their period is from lack of progesterone. And a lot of times those women grow up in very stressful households as children because the progesterone, if you're under fight or flight or stress, progesterone goes straight into cortisol. And progesterone makes the lining nice of your uterus. And then when you get your period, you shed your lining. But if you've been under a lot of stress, because I've worked also with drug addicts as well, women drug addicts who had a lot of stress as children, and all of them have very, very rough menstrual cycles. So, and there's things that you can do for that to rebuild that up. But anyway, just sorry to go off
Right.
of the
Good. So
track.
we've got synthetic progesterones and estrogens being prescribed. We've got a sidebar into too much stress takes progesterone down the pathway.
Right. And for your listeners, if you have cramps, one of can I just say a miracle remedy, I wish I'd had it as a kid, is black currant seed, 2 capsules at bedtime. And usually that'll ameliorate that in 2 months. And you can take it about 8 times a day to 4 times a day. I mean, if you have your period. So just a little sidebar remedy there for them. Anyway, let's go back to Dr. Elred Taylor. So he said, and then he showed, and there were about 12 gynecologists. What do we give for all these women problems? Amenorrhea, dysmenorrhea. So, we give 3 drugs. That's all we give. And he said, he said, after 7 years of that, I was ready to commit suicide. What am I doing? And then he said, for those who don't want to learn about natural things and bioidentical hormones, I'm going to at least teach you to have more time, because all you really need to do is get a headset to the front desk and ask room A, how old are they and do they have a uterus? And then grab the sample and have your prescriptions pre-written. And then he said, before you leave, by the way, have your antidepressants in your pocket, because if what you're giving doesn't help, the women are crazy and they give them the antidepressant. And then when that doesn't work, you get to do the big ticket item, because that uterus will never work. Just, you rip it out. So with that, and so my friend turned to me and she goes, oh my gosh, that's why I always send you my GI patients. I can prescribe Nexium or Prilosec and order a scan, and that's all they do at our GI department. There's nothing else for the people. So she asked me to go and do a physiology lecture on the GI tract for her group. And she said, do it the way he did. Go get the big textbook, the Guyton that we learned, which, by the way, I have it right here. It's
Right,
like
right behind
14,
me.
1,400
Yep,
pages right here, Guyton Medical Physiology. So I go to
by
the
who?
book yeah, behind you. Yeah. And he goes, go there. And the lady was at I went to University of Miami bookstore and she didn't speak great English. So I'm going, Biblioteca muy grande, because she's giving me these little tiny book that looked like a Reader's Digest. And she said, oh, I'm going to give you the main librarian that runs the bookstore. And she goes, that is the physiology book. I'm like, what? She goes, yeah, that's the one on cardiology. It was probably it was like Reader's Digest, and it was about half as big. It was just this tiny. She said they've broken the body into pieces. And I said, but they'll never learn that most heart disease, because she said that one was for the heart. I said, they'll never learn that most of it comes from stress in your adrenal, and it has nothing to do with your heart whatsoever. And she said, and she burst out laughing. They go, they don't learn anything anymore.